The title of our study is Long-Term Survival Outcomes for Hormonal Therapy in Premenopausal Patients with Clinical Stage 1 Endometrial Cancer. What we are going to look at is to determine the trends in and patterns of use of primary hormonal therapy and long-term survivals. Long-term survival outcomes of reproductive age patients with early-stage endometrial cancer. So we use National Cancer Database, which has 70% of newly diagnosed cancer cases in the US, and this is a retrospective study. So we have two major parts in this study, and the first one is trends in and patterns of use of primary hormonal therapy. And the second one is survival analysis by propensity score matching cohort, which has 2,000 patients. We try to balance the background factors available between the two primary treatment groups. So we include patients 18 to 49 years old and endometrial cancer, grade 1 or grade 2, and stage 1A, and diagnosed as 2004 to 2020. So our main findings is the utilization rate of the primary hormonal therapy has increased over the last 15 years. And the percentage rose from 4 to 5% around 2004 to 2010, and going up to 12 to 40% in the recent years. The younger age, non-white race, and patients who live in metropolitan area, and patients who are treated at academic cancer center, and the patients who are treated at facilities in the northeast area in the US were associated with the use of primary hormone therapy. And in terms of tumor characteristics, grade 1 and stage 1A are associated with primary hormone therapy use. For survival outcomes, the propensity score match cohort is well balanced between the two primary treatment groups. And overall, after 10-year follow-up, the survival rate was decreased by 4.1% in a hormonal therapy group compared with surgery group. Hazard ratio was 1.84. In age subgroup, patients younger than 40 years old, the two primary treatment groups showed similar survival probability at any time point until 10-year follow-up. Surprisingly, among patients aged 40 to 49, the survival was inferior in hormonal therapy group at 5-year and 10-year point. Hazard ratio was 4.94. So to conclude, given the growing number of patients with early-stage endometrial cancer who may desire fertility preservation, we need to acknowledge the potentially poorer prognosis when patient and provider select the primary hormonal therapy. Shared decision-making is further needed for this setting. And also prospective data with a large sample size should be needed for making this evidence more robust. So thank you so much.